Older babies and young toddlers become easily distracted when they breastfeed, and they may hear a sound or see a light out of the corner of their eye, and while nursing and still latched, want to pull over and see what's going on. Or they may try to change positions frequently while nursing because they're distracted or uncomfortable and just wiggly. And this is okay, these behaviors are normal, but if allowed, they will continue to persist. You mentioned that your son will nurse on one side for just a couple of seconds and then want to switch to the other side and does this again and again and again throughout a feeding. You want to know what you can do about it. And basically you have 3 options. Your first option is just to conform to his requests and the behaviors will continue. And if that's okay with you and him, then that's all right. The second option, and since you sound like it's bothering you a little bit, may be your best option. It's to try to encourage him to stay on one side as long as possible. And if you persistently enforce this for a few days, then he'll probably get the message that he needs to stay on one side before you're going to switch him. Also keep in mind that milk just doesn't automatically start flowing when a baby starts sucking, and so this may be the reason for his impatience. He needs to stay on one side for longer than just a few seconds for your milk to let down and for him to actually get something productive out of the feeding. So if he stays on one side and he's able to do this for a while, he'll learn probably to stay in one position and then switch to the other side after he's finished the first. Your third option is to just stop nursing if he won't stop those behaviors and he's not responding to the things that you try. He's been nursing for 13 months, and that's amazing. You've gotten him to this point. And if you feel like it's time for him and for you to stop, then that's okay. Just make sure that if you make this decision, you don't stop nursing cold turkey. He may stop, but you need to either continue to manually express or pump off a little bit of milk and wean your body slowly so that you don't have engorgement and clogged ducts and mastitis. So if you were going to wean, you'd want to cut out one feeding every 2 to 5 days and slowly increase the amount of time between nursing sessions and slowly decrease the amount of time you let your baby nurse. Good luck with everything, and if you have more questions in the future for me, feel free to ask them on our Facebook page at facebook.com/Intermountain Moms, and recommend us to your friends and family too.